So coming to the presentation of the topic repeat breeding. So now we know that every one of us, you, me, and everyone has some of the aim or target or goal, whatever the thing that we say. Similarly, for a dairy farm, be it a farmer of small scale or medium scale or large scale, everybody has some target or some aim so that the farm runs a good economy. So for if you talk to any farmers, there are two issues that comes as a target for them or aim for them. One is his or her animal has to produce more amount of milk, ample amount of milk, and at the same time it has to produce more number of calves, especially for the replacement stocks in case of females. So these two invariably comes in everybody minds and a aim or target. But these two are actually directly related to one that is called reproduction efficiency. So without reproduction efficiency of sufficient quantity, it is not possible to get more number of calves as well as more amount of milk from a particular animal. So to get these two or to get the maximize the reproductive efficiency, the target for the farmer is one line, or you can say a single 6 words. That is a calf per cow per year. It looks very simple, but it is not so. Even the farms which owns a lot of machineries, every automation, everything is there. There also, it is very, very, very difficult and it is seldom achieved. Then why we keep this target? Once we have this target, then only within a stipulated or within a desired generation interval, we can make the calving period perfectly so that the farm runs in economy. That's how the aim is. That is, we say it's a Tarak mantra. Mantra for a dairy animal reproduction is a calf per cow per year. And to have this, what we say is automatically every year the cow. In case of cattle, it is every year it has to produce a calf. In case of buffaloes, once in every 13, 14 months, because the 1 month gestation period increase in this particular animal. But what is happening actually, when we aim for 12 months, I am going to present here the data from the organized, well-organized farm where data are adequately available and documented properly. So it says it is more than 15 months. So here in a organized farm itself, there are a gap of 3 months in case of cattle. But in case of buffaloes, it is more. It is 18 months. And if you go to the field condition, I am damn sure that this 18 months will come to the cattle and once in 2 years will come to the buffaloes. I am not generalizing everything, but in the majority of the population, other field conditions goes into this. Why it happens? We aim for something, but we are not able to. So to have a knowledge about why it is happening, we have to have a basic understanding of dairy cattle reproductive cycle, which I know many of you already aware. But there are some points, and those points need to be highlighted for intervening so that we have a desired calving interval. As far as the primary cycle, in case of human, primary infertility, secondary infertility. Similarly, in case of animals is also there, but not that much clearly explained and documented. But if you see the primary, means from calving, from birth of the calf to deliver the first calf, there is literally no much problem except one area where the puberty and sexual maturity that has to be attained, and that is a problem in both indigenous cattle as well as buffaloes. But a problem happens after that. Once the calving occurred, means the first the heifer is calved, because of the calving associated stress, be it a physiological, be it a pathological, be it called whatever the thing. So these stress and physiological deviations, they cause something to the cow and make her infertile or delayed reproductive efficiency or reduced reproductive efficiency. So what are they? These are all the things I have enlisted. I'm not going to explain everything which you know already. But here, the main thing is the uterine involution and then the transitional cow management and the cyclicity. These three, if you are taken care, then automatically the secondary cycle can also be brought within our target level. Normally, what we expect is in primary one, and after that, at least 6 to 7 calves. That is, 7 to 8 such cycles are expected in case of a dairy cattle. But what is happening nowadays? I'm not talking about 3 decades or 4 decades back, but now what happens is after 3 lactations or after 3 calvings, there is a huge or higher incidence of reproductive disorders problem. And that's how in abroad, in Western countries, these animals are used for the culled and used for different other purpose, which in our country we cannot. So we have to live with these animals. So for that reason, we have to understand the intricacies of these 3 problems and make them to come into cyclicity. So what are the major factors that contribute to the prolonged or extended calving intervals? We can say this is the period from calving to conception, and this is we call as a calving to conception interval. This is the direct, this has a direct influence on the calving interval. If you see, mainly the functional disorders account to 65%, and that is postpartum aneistress 25%, repeat breeding 21, and uterine infection 29. And of course, this repeat breeding and uterine infection has some overlapping etiology for that. So if we understand these two, this 21 and 29, almost 50% of the problematic animals which are having extended calving intervals can be brought into normalcy. So with this background, we'll be talking about repeat breeding, and intentionally I have given within bracket due to uterine infection in cattle and buffaloes, because I'll be giving more emphasis on uterine infection causes repeat breeding in the later part. But repeat breeding is a burning problem. That's how as such repeat breeding we will be discussing for another 10 to 15 minutes, and after that we'll go. And one more thing is, whenever we talk about repeat breeding, we always believe, and we are been told over a period of time that it should be uterine infection free. But why I am taking now repeat breeding due to uterine infection, this you will come to know in the next slide. So defining a repeat breeder. You may think that what is the definition? Everybody knows. If the animal is not conceiving 3 times insemination, then it is repeat breeder. It's not so actual. The perfect terminology used to define repeat breeder is something different in 1960s and 1970s. If you see, I have reproduced word by word, because word by word is very important for designating a cattle as a repeat breeder. If you see the repeat breeder cow, when Roberts defined in 1970s, Stephen J. Roberts defined in 1970s, less than 10-year-old, there is a meaning for that. After 10 years, automatically the reproductive efficiency comes down in majority of the cattle. There are some examples which can go up to 20 years, but I am not talking about those particular examples, but as a majority. So less than 10-year-old have normal estrous cycle, apparently free from palpable clinical abnormalities, no abnormal vaginal discharge, calved at least once. This is also very important, because to prove that yes, this animal is worthy for reproduction, but failed to conceive even after 3 or more consecutive mating with a fertile bull or inseminated using a fertile seed. This was the classical definition for repeat breeder, and at that time the incidence or prevalence of the repeat breeding was calculated based on all these factors. But over a period of time, it has transformed into for user-friendly or some other reason, I do not know very clearly. So after a decade or something like that, because when AI was used, it was ensured that the semen quality or semen which we are using in artificial insemination is quality ensured. That's what we assume. But in reality, it is something different. Because I'm not talking about the quality of the semen, but because of some developmental issues and other things, the sperm quality getting deteriorated. That I will come into the later part. But for that reason, the definition was changed later into failure to conceive from 3 or more regularly spaced services in the absence of detector. This is also a good definition, because the regularly spaced services is very important. The animal is cycling properly, and that's how even after 3 inseminations it is not. So here the dilution is made on the age and then on semen, because semen was considered to be good in case of artificial insemination. But in the later part, still it is further diluted. The repeat breeder cow is any cow or buffalo that is not conceived after 3 or more services. Here even the age is surpassed, semen quality is not talked about, whether the animal is cycling correctly or not, that is also talked about. So the repeat breeder definition has been diluted, and now what we calculate, what I could see some of the papers published in our country and some other countries as well. Any animal, without knowing the history also, it is being designated as a repeat breeder, but they are not truly repeat breeder actually to say. So what we are going to speak now hereafter is considering the layman terminology of repeat breeding. Forget about all these things. We say that the animal is inseminated 3 times, it is not being conceived. So how this animal can be made conceived? That's what we are going to speak. So having said this, we have to first understand this. What is the impact? Why this much we are? Because whatever the incidents I am telling, it is the 3rd or 4th definition, not based on the first definition. So actually the true incidence of repeat breeding is far less than what is being reported here. But these are all the things. If you see, there are some versions, again, field veterinarians as well as researchers, there are some breed of cattle which are given or said that they don't have much repeat breeding problem, whereas some other breeds are blamed that they are the culprit and they are causing the repeat breeding problem. But whatever the data I could see with my little knowledge, there is no clear-cut difference into that. And this reference I have taken from Dr. Prohit's article in 2008. He has means almost 20-30 breeds incidence of repeat breeding he has given. I have selectively used some of this data. If you take the crossbred, 13 to 23, Haryana breed 14 to 27. So overall, if you see, the incidence is 5 to 30% in case of both cattle and buffalo. So this is the incidence which is coming from 1960s onwards. There is no sudden hype or something like that in case of incidence of repeat breeding as well. But the impact is quite high in case of breeds. If the higher producing animals are affected with repeat breeding, automatically the milk loss will be very huge. That's how it has been estimated by the National Academy of Agricultural Science India that about 40 to 50,000 crores Indian rupees is the annual loss due to repeat breeding and anti-stress alone. So this needs to be really looked into. So this is a basic how the process of conception takes place in the normal AI, because many students are there, for them it is even. For example, in artificial insemination, the semen is deposited into the uterine body. And from there, if everything is perfect, the spermatozoa is getting this. Credit goes to my student, Dr. Nilendu Paul. He could make this for me. So this spermatozoa moves by its own as well as by mother, and then reaches the particular point in the reproductive junction. And then after that, thereafter some selections the mother does as well as the spermatozoa itself undergoes, and then automatically it moves to the fertilization process. And once the ovulation is taking place, automatically the ova comes, and then they make a love in the love tunnel, and that results into the conception, and the embryonic development takes place till the postulation. This was the normal. But what happens in the repeat breeding? If you see, there are some 1, 2, 3, 4, 5, 6, 7 steps, and these 7 steps in the normal AA are altered or bound to be altered because of some other reasons which I have narrated in the right side, and that's how the cow is repeating. First itself is insemination. Insemination skill, all the inseminators are not equally skilled. So there are some individual differences. It is not only inseminating or taking the gun inside the uterus and depositing, but each and every small minute step will affect the sperm quality. That one has to know. That is very important. I can take the gun in my back like this, and then I can inseminate and show that I can get it conceived, but it is not the reality. 1 or 2 animals may conceive, but not in the majority. So first and foremost thing is the person who is inseminating, whether if it is rightly inseminated or not. That is important. And second is that spermatozoa, once we inseminated, this has to go to the love tunnel to meet the partners. If this fellow cannot go because of one or other reason, like uterine infection, and that way it is affected, and then sperm transport is affected, then it cannot go. Then after that, here uterotubal junction, I always repeat in all my seminars, it is the mother who selects the spermatozoa who is going to father her offspring. Be it a sex, be it a quality, be it everything, it is a mother. She understood each and every horoscope of the spermatozoa, individual spermatozoa, and select only one. So that selection is very important, and that selection, if it is impaired, ineligible spermatozoa are allowed to fertilize her oocyte, and ultimately she recognizes that I have done a mistake and this fellow is not going to grow normally, and he or she has to be terminated, so she goes for abortion. So that one is third and fourth. And then fifth is, if there is a problem, that's how you kindly recall the classical definition, the animal must have calved once. That means anatomically she was very normal at that time, but after that maybe some acquired anatomical problem was there, that's how she could not. So this is the tubal block or something like that. If it is there, then this cannot happen. And the sixth is ovary. If the ovulation takes place properly, then it is fine. If it is a delay or there is no ovulation at all, anovulation, of course the treatment is same, but it impairs the conception process, and that's how the cow is repeating. And the major reasons for repeating is 25% is genital infection in case of buffaloes and 20% in case of cattle. And hormonal is 28 to 25, the remaining others is combined. So if we take care of these two, then we can address majority of the repeat breeding problem. So this is a snapshot of what are the possible causes and how we can approach. So if you take, there are major 2 causes only till this time, from 1940s onwards to till this time, it is classified only 2 causes, major causes for repeat breeding, that is failure of fertilization and embryonic mortality. How it occurs, who contributes to what? If we know who contributes to what, then only we can aim for approaching or treatment of that particular case. If you see, first is improper genital environment in case of females. Yes, if the genital environment, I'm not talking about the clinical pus and other things, then we will not go for insemination at all. But we cannot visualize by naked eyes the infection or whatever the minor alterations in the uterine environment. If it is there, automatically the sperm will not move, or if the spermatozoa moves, its quality will be derailed and it will not be getting properly capacitated. That's how fertilization will be a problem. And then improper sperm transport, yes, it happens. If the cow is under stress or something like that, automatically the oxytocin level or hormone level, it is getting altered, and it is not going to elicit the response so that the sperm get transport. The sperm transport occurs by 2. One is by mother as well as by sperm movement. So here the mother's that movement is impaired. Ovulation abnormalities, anovulation and delay ovulation. inadequate sperm selection. Again, I am repeating because these are the things you will not find in a classical textbook. But these are all the recent concepts. If the mother do not select spermatozoa properly, it will not culminate into the full gestation. So that is also a cause for repeat breeding. In case of male subfertile spermatozoa, what we understood in the classical definition and after the two definitions, the male is removed because we consider that the males undergo rigorous selection and rigorous process and then the quality is ensured. But it is not so in many cases. Seeing is believing. But if you see the spermatozoa, they look like similar in subfertile bull or in the normal bull. But if you go for some other analysis, then it says that this fellow is weak. So in case of subfertile spermatozoa or spermatozoa from bull, subfertile bull, if we used RB condition, repeat breeding will be there. Altered sperm phenotype, then ineffective sperm delivery and improperly timed insemination. So these are all human factors causing repeat breeding. In case of early embryonic mortality, again subclinical uterine infection, delayed ovulation, aging of gametes, and inadequate luteotropic support. So each and every point here is a reason, and that can be taken care in case of repeat breeding for improving the conception rate. Altered sperm molecular health, I'm not getting into much, but because you know very well, the spermatozoa, they don't transfer only DNA from the father to the mother. No, there are n number of the molecules. They are important for embryonic development and pregnancy maintenance. If spermatozoa is not there properly, or these molecules are absent in the spermatozoa, or the spermatozoa underwent some of the damage wherein these molecules are lost, then the embryonic mortality is bound to take place. So that's what I told, altered sperm molecular health. And then again, improperly timed inadequate management. So in these given cases, the normal, this is happening, RB, it is getting altered, and these are all the factors contributing. So how to approach normally? I'm not that we have to understand first a normal and repeat breeding head. It is humanly impossible for any of the person in the earth to make 100% of the animals pregnant. It is not possible at all. It is something beyond what we have understood. It is beyond something of a capability. So in the situation of the normal herd, where the reproductive efficiency is quite normal, if you see, failure of fertilization occurs 10%. And then embryonic death within 3 weeks, 30%. And here the last column, you see, early embryonic loss within a limit should be regarded as a normal due to early elimination of unfit genotype. This is a natural process. So if I inseminate 100 animals, 40 animals in a normal herd are bound to repeat, bound to come to the heat next. If this is the case in the normal, how RB is deviating, repeat breeding is deviating. If you see a group of repeat breeder, they are repeat breeder. They have been inseminated 3 times. But if you go for 4th time, at least 15-25% of the animals they will conceive by themselves, without any hormonal intervention, without anything. And then these are all the cause of concern for us, 15, 25, and then 35. This is anovulation or fertilization failure or embryonic mortality. So these 50% area we can concentrate and improve.